When patients come for oral appliance therapy, they often want to know what is the cause of their sleep apnea. And very often it's the position of the tongue and the size of the tongue, because it doesn't fit into their narrow arch. So patients ask, why do they have narrow arches? And it goes all the way back to the development. When the baby is breastfed, the pressure from the breast as their milk is being expressed actually pushes against the palate where the sutures are, and it makes the palate wide and well developed. Very often those babies who are not breastfed, their jaws are not the same shape, which often leads to narrow palate and reduced tongue space, which pushes the tongue to the back of the throat and increases the risk of sleep apnea. The second very common cause after breastfeeding is introduction of solid foods. If the baby stays on processed and very soft foods for a long time, the jaw is not developed well either. You really need the chewing forces to keep pressure on the bone to develop it properly. On my screen, there's an example of two siblings who were breastfed, but one was on baby food for quite a while, and the second one refused the baby food. And look at the profile. This boy has more straight profile and more wider arch. You can't see it on the photo. And the girl right here, when she was 6 months old, she was introduced to the baby food and she stayed on it for 2 years. And her jaw is not well developed and it's pushed more to the back. And the tongue sits together with the jaw to the back, increasing risk for sleep apnea. So if you know anybody around you, in your family, or somebody asks you what possibly can cause the jaw development, or is it a good idea to be breastfed, please tell them so. Yes, it is. Let's encourage young mothers breastfeed their babies so their jaws develop properly. Or if you have a young child who did not get a chance to be breastfed, seeking early interventional orthodontic intervention would be very important. So if you know anybody who needs advice on what to do with their babies who did not get a chance to breastfeed, or they suspect they have a baby who is not developing properly, please send them our way and we will give the best advice possible so they can grow to breathe better, live better, and sleep better when they're adults.